Hello, Facebook friends. Thanks for joining us here for this next edition of Bringing the Zoo to You. We are back here in the animal hospital where today Hamilton, one of our Red River hogs, is having an exam performed. It's always a little bit challenging for us to get things to line up perfectly with this 11 o'clock Facebook time slot. But where we're at right now is we just finished a CT scan with Hamilton and we've moved back here into our treatment room. So you'll see everybody is kind of getting the monitoring equipment hooked back up onto him from an anesthetic standpoint. So anytime we have animals under anesthesia, we're always monitoring their heart rate, their respiratory rates. You can see them getting a blood pressure cuff on the animal so that we can keep track of their blood pressure and all of the different things that we monitor to really ensure that our anesthesia is safe and that we're providing a good quality of care for our animals here at the zoo. So as we get Hamilton situated back here in the treatment room, we can talk a little bit about what's happening today. So Hamilton was over here for a preventative care exam. He's a fairly young pig. He's only about 4 years old and was born here at Brookfield Zoo. During these type of exams, we do a variety of different procedures to monitor the health of the animals and make sure that they're in the best shape that they can be. So we're collecting some blood from Hamilton. We're going to do some advanced imaging on him. So we just finished up the CT scan a few minutes ago, and that really gives us the ability to look at all of the internal organs. So we're evaluating his health. And then we also have the opportunity to look at all of the different bones and joints in his body. As a young, only 4-year-old pig, things look great right now, which is wonderful, but it's also really important for us to have those images that we refer to as just kind of baseline images. So we know how his specific joints looked when he was young, and as he gets older and degenerative changes may start to come into play, things like degenerative arthritis, we're able to go back and refer to those images that we took today to really understand exactly what his joints should look like when they're healthy. You'll see Dr. Allender is also taking a feel of some of those joints, so that's another part of our normal exam process, is to just feel how all those different joints feel, how they're moving, whether we sense any arthritic changes in the joint, any swelling, any type of abnormal changes. That's just part of a good comprehensive exam. For those of you that have dogs or cats, you probably see your veterinarian do the exact same thing at their vet's office, where they're just really giving the animal a good once-over from head to toe to make sure everything is healthy and feels appropriate. With Hamilton here today, we're also going to take a good look at his mouth, at his teeth, make sure that things are wearing appropriately. Again, as a young animal, we really don't expect to find problems in these exams, which is wonderful when we don't, but we also want to be very thorough and make sure that we're evaluating everything. You can see these hogs have a pretty significant set of teeth there, which is something that I think a lot of people don't realize is exactly how big of teeth and tusks that some of these hog species can have. Red River hogs are also known as African bush pigs. They're native to Central Africa. They eat a variety of different food items. They're really kind of an omnivorous species, meaning that they are both carnivore and herbivore. When we say omnivorous, it's just a reflection of the fact that they eat both other animals, insects, as well as a variety of different plant-based materials. We'll also take a good look at Hamilton's eyes during this exam, and then the blood that I mentioned earlier that we're collecting also gives us the ability to look at all of the different internal functions of his body. So it lets us look at things like liver function, kidney function. It gives us an idea of how his red blood cells look and make sure that his white blood cell counts are appropriate. The white blood cell counts can give us an idea if there's any infection or inflammation taking place within the body. You'll see Dr. Allender is also using a dental probe here on these teeth, and what we're looking for there is just any sort of pockets or a gingival recession. So we're making sure that the tissue around the teeth are still solid and holding those teeth appropriately, and that there's no loose teeth in there, and that there's no material being pocketed around the tooth that could lead to an infection. People have this exact same thing done when we're sitting in the dentist chair. It's just something that we can't often see being done to ourselves. But if you watch a dentist looking at a person, they're going to do those same things where they feel around the gum lines to make sure that there's no pockets around the teeth that could be problem down the road as far as that tooth developing an infection or becoming loose.
So are all of the people who are here today doctors?
That's a great question. So we've got a variety of different people here with us today. So Dr. Matt Allender is one of our clinical veterinarians here at the zoo, and he's overseeing this procedure today. We also have 2 of our veterinary residents with us today. They're here in a 3-year residency program where they're really focusing their skill sets on non-domestic animals and more specifically on zoo and wildlife species. So this is a residency program that we share with the University of Illinois Vet School as well as Shed Aquarium, and they rotate through the 3 organizations to really get a very broad basis of animal experience with a wide variety of different species, both terrestrial mammals as well as aquatic animals. Ashley's one of our veterinary technicians there at the back. Our veterinary technicians we talk a lot about. They're really just sort of the pillar upon which all of our exams are based. They take care of so many different functions for us here every day that we really we can't say enough wonderful things about the care that our vet techs provide and the support they give our veterinary team. And then Natalie here in the green shirt is one of our veterinary students. So she's from the University of Illinois in the last year of her clinical rotations. And as part of those clinical rotations, students will spend anywhere from 4 to 8 weeks with us here at the zoo, getting exposure to non-domestic animals, so things that they are not commonly held. This is really the opportunity for them to expand some of those skill sets. Hamilton is also a great example here of how we use domestic animal medicine as the basis for a lot of what we do. So although Hamilton is a Red River hog and definitely not a domestic pig, a lot of the medicine is still very similar. So the knowledge and the skills that veterinarians gain during vet school in working with just domestic swine also applies off to a lot of these non-domestic wild species that we work with.
So how often would Hamilton get this kind of exam?
It's a great question. So all of our animals are set up on what we refer to as our preventative medicine program. And within that program, we really tailor the exams to the specific animals. So a younger animal like Hamilton here that's only 4 years old would have one of those exams done every 2 to 3 years as really a top to bottom checkup. We give vaccines during those exams. We do all the different procedures we've just been talking about. As some of our animals get older, however, and start to develop problems or may have either geriatric changes to their health or just other problems that are arising, in those situations we look at those animals more frequently so that we're able to carefully monitor and stay on top of those different health issues as they get older. Our animals also get what we call a neonatal checkup, so that would be like a puppy or a kitten checkup at a domestic animal vet's office, which is where they get all of their young animal vaccines. We make sure that they're healthy, that there's no problems that they were born with, and just really give them a good checkup at that point in time. Jenny is another one of our veterinary technicians that you can see there just shaving the leg, and what they're doing right now is looking for a good vessel to put an intravenous catheter into to be able to give Hamilton some fluids during this exam, as well as having a good place to give medications if we should need it during the exam.
So what's something unique about working with a Red River hog as far as like an exam goes?
So our swine species here are kind of an interesting example of where we really can apply that domestic animal medicine over to some of these non-domestics. So it's always really interesting to us when we have an animal like this where compared to a domestic pig there may not be a whole lot of differences. However, those differences are very profound when you're working with these animals when they're not anesthetized. So it's sometimes easy for us to slip into a mindset of, oh, this is, a domestic animal because it's so close to, a domestic swine. But we always have to remember that these are wild animals. So we always have to take that into account when we're working with these species, is that even though they may look incredibly calm and docile, we do always have to remember that they are a wild animal and that they're not domesticated, and we need to make sure that we manage them accordingly.
About how long would this exam, I cannot talk today. About how long will this exam take?
These preventative care exams really depends on exactly what we're doing. So today, as far as just this general checkup and the CT scan, this is not going to be a terribly long procedure today. In general, most of our procedures like this take anywhere from about 90 minutes to 2.5 hours. Part of that time is spent just on the anesthesia induction and recovery. So for this animal specifically, we anesthetized him in his normal habitat, so then we're transporting him over here to the hospital while he's asleep. That's for his safety as well as our staff's safety. But that does add some significant time, obviously, where it's usually a 20 or 30 minute induction period for the anesthesia, and then anywhere from 20 to 30 minute recovery period as they're waking back up. We'll take Hammy back over to his normal enclosure when he wakes up. So he's going to wake up back in his normal habitat, in normal surroundings, and really have no recollection whatsoever of what happened here today while he's under anesthesia.
Now, every time we see one of these procedures, whether it's an exam or a surgery, everybody seems to know exactly what they're doing at all times. Like,
yes.
You're such a well-oiled machine over here. So how do you get to that level of efficiency? What do you guys do to plan it out?
That's a wonderful question. We have an incredibly dynamic and cohesive team here at the hospital. So we know what everybody's role is. We know what to expect from one another, and we're able to make these exams happen, in this case, fairly silently. So normally there'd be a little more chit-chat going on between everybody, but because they're all staying quiet so that I can talk loud enough for the folks here on Facebook to hear me, they're using just a lot of nonverbal communication between each other, and that really just comes from repetition and the team dynamic that we've got here at the hospital. Everybody knows what they're doing, everybody knows what their role is going to be, and they really just kind of seamlessly move through these exams accordingly.
That's excellent. Someone wants to know, do things ever get hectic during a normal checkup exam?
Oh, they certainly can, yeah. Anytime we've got one of these animals under anesthesia, we run the potential of finding something that we're not expecting as far as a new problem or a new concern. That can be anything from, a mass that we feel on their body somewhere, some sort of skin issue in an area that we can't see when they're awake, to an infected tooth. Any number of different things can come up unexpectedly as a problem while we're doing these exams. And in those cases, we have to make the choice in the moment of, do we take the time today to address that problem and prolong their anesthesia, or do we schedule it as a second follow-up procedure sometime down the road? Our team is wonderful at being able to adapt to those situations when they come up. So if we find an unexpected problem, we're often able to just kind of quickly mobilize what we need to address that problem in the moment, so that we don't have to put the animal back under anesthesia again at another point in time. We do often have multiple procedures going on. We showed that recently in one of these Facebook videos where we had two different things going on two different tables. That's another thing that can certainly be going on, is that we have multiple scheduled procedures on top of each other, or we just have a new problem come up in one of our animals, in the morning, and we have to slot that animal in for an appointment as well. So we'll frequently have 2 or 3 things going on in this room at one time. Mm-hmm. So we can see everything over here behind Jenny too. I'll point all that out. So this was everything that went over to the building with us this morning when Dr. Allender went over to bring Hamilton back here to the hospital. So these are different drug boxes as far as anesthetic drugs, emergency drugs, and then a whole lot of equipment just to be sure that we can safely bring the animal back over here to the hospital if something should come up as a problem. The suitcase looking bag there in the back next to the oxygen tank is one of our emergency bags. So it has just a basic set of emergency equipment. If something should arise during the anesthesia, we've got everything we need to address that. So we really mobilize a lot of the materials from our hospital anytime that we're out in the park working on an animal, so that we always have what we need.
Mm-hmm. So how much education does it take for someone to be a vet tech?
So most of our veterinary technician programs are either a 2 or a 4-year degree. And then as far as the specialization here within the zoo medicine field, we do offer a vet tech internship here at the zoo, which allows vet techs to come in and work, side by side with our team to pick up those skills on the non-domestic animal side of things to gain this experience with zoo and wildlife species. They're wonderful in everything that they do. We really can't say enough wonderful things about our vet techs, and they're the power behind the machine here in the hospital.
Mm-hmm. And then what does it take to become a veterinarian, especially when you're working with exotic animals?
Yeah, so from a veterinarian standpoint, it's 4 years of undergraduate school and then a 4-year veterinary medicine program to become a doctor of veterinary medicine. While we're licensed at that point to work on any animal, those vets that want to focus into zoo and wildlife medicine generally do at least a year-long internship program and then usually a 3-year residency program on top of that. So that's the program that I mentioned earlier that we share between Shed Aquarium, ourselves, and the University of Illinois, and that really sets them up to become a diplomate, which is a board-certified specialist in zoological medicine, and that's what we really look for from our veterinary team here at the hospital.
We have a lot of animals here at Brookfield Zoo, and do they all come in for these exams?
Yeah, so we track everything from a preventative medical standpoint. For some of our animals, that means these type of routine checkup exams on a regular interval. For some of our other animals, that may be more of a visual exam at their normal habitat or enclosure by one of our veterinarians, or in some cases we do more of a preventative approach in terms of monitoring as a collection group. So when we think about like our budgie aviary here at the zoo, there's close to 1,000 birds in that building, which makes for an incredible experience. But it's also a very large flock of birds for us to manage. So we tend to take care of those animals more as a flock and do flock-wide treatments and flock-wide assessments rather than looking at every individual bird on an annual basis.
I have one more question.
Yeah.
Is he going to throw away his shot?
Is he what?
It's a musical.
Oh, Hamilton. Yeah. Oh, that was good.
Come on, study your history, Mike.
Yeah.
You did. But he will not.
All right. Well, with that, we're going to wrap it up. So thank you all for joining us here at the Animal Hospital today while we wrap up this exam with Hamilton, our Red River hog. Our Red River hogs share a habitat with our Nyala, and we now have some African crowned crane coming into that area as well. So the next time you're out here at the zoo, please be sure to swing by our Habitat Africa region of the zoo. Make sure you say hi to Hamilton and our other Red River hogs, and we hope to see you all out here soon. Have a great day.